Dr. Google, good or bad? So I think this is in two parts. The first part is, do we want our patients to have looked things up about their illnesses and bring questions based on the things they look up? Yes, I think this is a really good thing overall. The internet has allowed wider access to information for people about health generally and their diagnoses and illnesses. Obviously, that can be a little problematic, and I think that's becoming more of a problem because there's now misinformation. Without, medicine is complex and trials are done in certain ways that can just be misinterpreted. It can actually be misunderstood and misinterpreted even by doctors and scientists. So, for people who don't have that baseline knowledge, it's even trickier. So I guess it depends. What I'm saying is it depends what your baseline knowledge is and then what you're understanding from it. But overall, I think it's good for people to read about their illness, and then if they don't understand something, to just bring those questions to their doctor and be able to ask those questions and then chat together so that they can understand better. That's a really good thing. The second part is, people complain a lot. They say, oh, my GP's a bit crap because my GP Googles things in front of me. And so, GPs don't know anything. That's something I hear a lot. I have to say, it's like all doctors Google stuff. I'm not a GP, I'm a hospital doctor. And I work in palliative care, so in different settings, but I Google loads of things. And can't speak for all doctors, but I'm pretty sure that probably nearly all doctors Google things, if not all doctors. The difference to that is that we have to remember an awful lot of things, and also guidelines change all the time. Every medicine's being constantly updated. The difference in terms of, we're not just randomly Googling, we are reminding ourselves or looking up the most up-to-date guidance to make sure that we're not missing something, that we're just reminding ourselves, just to double check. But it's intentional Googling, using the knowledge that we already have just to make sure we're doing our best by the person in front of us and the patient in front of us, and reminding ourselves of that knowledge just to make sure we're not missing something. So it's just not random Googling. I would say that you want a doctor who's Googling something, because we can't all possibly remember absolutely everything from, medical school, which for some of us is like 15, 20 plus, 30 years ago for some doctors. And medicine changes a lot in that time. Year by year, medicine changes. It's part of our job to keep up to date. So that's why we do it. Okay.